Hello and welcome to today's session of Guiding Children's Behaviour in-home care. Before we begin, I'd like to thank you for attending and acknowledge the traditional custodians of the land we meet on and pay my respects to elders past, present and emerging and to all Aboriginal people present. The outcomes for this session include what is behaviour guidance and why is it important, influences on behaviour, working with children who have experienced trauma, communicating with families, strategies for behaviour guidance, and we'll go through some reflective questions for educators. So firstly, let's have a look at what is guiding children's behaviour. Guiding children's behaviour is intended to help children self-regulate as they learn appropriate and acceptable behaviour patterns. These methods of guiding behaviour are continuous. Guiding children's behaviour is something done throughout the day, not just when a child acts in a way that we might consider to be unsafe or unacceptable. It is done while appropriate behaviour is occurring, as well as before, during and after socially acceptable behaviour is displayed. For example, comments such as, "I like the way you pack away the Lego before eating lunch," and "thank you for using your words to ask for help," is also behaviour guidance. So don't forget to reinforce positive behaviour too. While there are a wide variety of theories and approaches related to guiding children's behaviour, the goal remains constant: to assist children in developing respect, self-control, self-confidence, and sensitivity in their interactions with others. Is guiding children's behaviour the same as disciplining children? And why don't we use terms such as discipline? Does it conjure up negative connotations? Words which might come to mind when we use the term discipline might be punishment, correction, strictness, order, or control. As an educator, the term guidance is used instead of words like discipline or behaviour management, which tend to have a negative connotation. Should we guide children's behaviour in the same way? Children's behaviour is influenced by their overall development, their environment, and the adults who are caring for them. These are some things that we're going to discuss today. So guidance is about promoting social competence as opposed to behaviour management or discipline, which ignore the fact that skills are developing. To build positive relationships with others, children need to develop social competence and the ability to interact with others. They need to have care, empathy, and respect. Social competence is the foundation that allows children to understand and self-regulate their own emotions and negotiate their interactions with others. Understand that all behaviour has purpose. You can start by observing the children and having conversations with the family to gather objective information. So guiding children's behaviour involves all caregivers, parents, educators, healthcare professionals in adopting a positive approach towards teaching children about consequences and socially acceptable behavioural alternatives. Guiding children's behaviour is really about supporting their social and emotional development. So as an educator, this is a major part of your job. It is therefore appropriate that you spend the bulk of your time with children promoting social interactions, helping solve problems, and responding to intense emotions. You are promoting social and emotional development in every interaction with a child. So let's have a look at what influences a child's behaviour. Remember, there are many reasons for behaviour, and that is the most important fact. Rather than focusing on problem or challenging behaviour and getting frustrated and labelling the child, if we focus on understanding what is going on for the child, we can support their learning and development in a positive way. So some influences on behaviour include age, their developmental level, health, so if they have health issues or a diagnosis such as autism, developmental delays, if they're often sick or in hospital. If their basic needs are not met, maybe the child is hungry or tired. They may have gone through a family crisis. They may have attention issues. They may be bored, or it may be a reaction to having to wait. So think about how the environment in your program is reflective of the child's interests and distractions in the home. Changes in care, so if there's been changes with the educators or people coming in and out of the home. Educators' relationships, so do educators take the time to bond with the child, and are they reactive? And family dynamics, are there siblings or other children in the home? Are they older or younger? And environmental factors, noise levels, cluttered rooms, and lack of routine. These can all influence on a child's behaviour. Some other influences can include family relationships, changes to family circumstances, an event that has occurred in the community, limited social experiences, cultural expectations, exposure to drugs and alcohol, the child's emotional development and temperament, and the presence of disability that may impact on a child's social and emotional well-being. Something else that can have a great impact on a child's behaviour is trauma. So trauma describes the impact of an event or a series of events during which a child feels helpless and pushed beyond their ability to cope. A range of different events might be traumatic to a child, including accidents, injuries, serious illness, natural disasters, war, terrorist attacks, assault, threats of violence, domestic violence, neglect or abuse. And all children can respond to trauma differently. Trauma can negatively impact a child's physical, cognitive, emotional, memory and social development and lead to significant changes in their behaviour. This really depends on the nature and the severity of the trauma. When children are recovering from trauma and stress, they can be unable to control their emotions and their behaviour. So how can we assist children who experience trauma? We can develop strong relationships with the children, and this will ensure behaviour strategies can be implemented effectively. You may find children who have experienced trauma will initially act out and test boundaries with new carers. This can be a common initial challenge, and children may act out and test you to see if you're going to stay. Educators should not take initial rejection personally, as this is a common occurrence when we have children suffering from trauma. Allow time for trust to develop with the child. Maintain stability and patience. Trauma-affected children really need consistency. So set the foundations of positive and trusting relationships with the child before expecting successful implementation of strategies. Give yourself the time to settle in and go easy on yourself and the child. So here we have some behaviour guidance tips for trauma. How do we support children who have experienced trauma? The first thing we can do is create a safe environment. So we want to provide a place to be calm and engage in activities. We want to help children regulate their emotions. We want to remind ourselves of every child's potential. So model hope and optimism and ensure children are aware of their strengths and abilities. We want to set routines. Traumatized children do not always cope well with change or unpredictability. And lastly, we want to understand the relationship between emotions and behaviour. Try to find a balance of making children accountable for their behaviour, but also acknowledging the underlying emotions that are the cause. A really important goal that we want to achieve with all children is self-regulation. Self-regulation is the ability to manage your emotions and behave in accordance with the demands of a situation. It is a set of skills that enables a child as they mature to direct their own behavior towards a goal despite the unpredictability of the world and our own feelings. Self-regulation contributes towards children growing independence and behaving in a socially acceptable manner. Being able to consistently regulate their own feelings and behavior is a major task for young children. This should be the main communal goal for educators and families. Part of an educator's role is to help children constructively manage their feelings and impulses. It includes being able to reflect on and regulate reactions to emotions like frustration or excitement, delay gratification and resist temptation and peer pressure, calm down after something exciting or upsetting, focus on a task, refocus attention on a new task, control impulses, and learn behavior that helps you get along with other people. So what does it look like when children have problems with self-regulation? So behavior of children who display difficulty self-regulating can be broken down into two types. There's externalizing behavior and internalizing behavior. So externalizing behavior includes things like tantrums, reacting aggressively towards peers and staff, not following adults' directions, hitting, spitting, crying. These behaviors are easy to recognize and tend to be noticed quickly. These types of behaviors are disruptive to routine and to others as it focuses at obtaining attention. So the child really wants your attention when they're doing that externalized behavior. When we look at internalizing behavior, we might see children become fearful, anxious, sad, easily upset, or withdrawals from social situations. Children who internalize their behavior tend to be more difficult to notice because the feelings are directed inwardly by the child and do not necessarily draw attention from others. So how can we assist children to self-regulate? So just like teaching children to swim or to read, we use scaffolding to teach children self-regulation skills. And these strategies are commonly used. The first one is modeling. So we want to demonstrate appropriate responses or steps to achieve a task. Calmly show the child how a frustrating task can be achieved without getting upset. So for example, you could provide plenty of cues to start off and allow plenty of opportunities for repetition. Make a comment that will acknowledge the difficulty and how you stayed calm. For instance, wow, that was really hard at first, and it would have been harder if you didn't stay calm. You were a good listener and you accepted my help. The second point is we want to talk about emotions with the children. So a wide range of resources can be used, such as books, social stories, role-playing, spontaneous moments during play. For instance, if you have a child that's displaying biting, you can ask them, did you bite your friend because he wasn't listening to you? What else could you have done to get his attention? When the child struggles with a difficult feeling, encourage them to name the feeling and what caused it. Wait until the emotion has passed if that's easier. Use hints and cues. So use simple directions, gestures, and touch if the child allows, as some children can be oversensitive to touch. They provide young children with valuable cues about how and when to regulate their emotions, attention, and behavior. For instance, talking in a whisper when a child is becoming overly loud can hint to him that they need to lower their voice and say something like, I use my hands to clap before he strikes another child. Could indicate that they need to think before reacting. To an extremely shy child, simply touching them on the back and saying, I'm here with you and it's okay to get closer to your peers can be a really helpful cue. Visual schedules. So timers can help with transitions as they tell the child how long and when they are going to have to do an activity. Timers also allow us to pre-warn the child when a favoured activity is coming to an end. Children can anticipate what's next, or they're pre-warned about a change coming. It will really help them organise themselves and organise their feelings and emotions because they can plan ahead. Another tip is to gradually withdraw adult support. So withdrawing direct support as children begin to demonstrate new skills. So as said previously, one of the aims of being able to self-regulate is to be independent. Therefore, it should prevent us becoming full-time emotional coaches. We really want these children to be able to do this independently. And the last point is acknowledgement. So as the children master their emotions, show self-control and follow instructions, provide descriptive acknowledgement, which will tell the child what they have done well. For example, you could say, "Thank you for sharing the Lego with Sam. That was really kind of you." Another important point we need to look at when guiding children's behaviour is how we communicate with their families. It's essential that educators develop partnership with families and feel able to discuss challenging behaviour with a parent or guardian. They can provide valuable insight about what strategies work best for their child. The child will benefit so much when the educator and the parent or carer have open and respectful relationships. Ultimately, we want to promote family-based practice, focus on the family's strengths, promote family choice and collaboration. Keep note that the types of behaviour a family accepts may differ from what is acceptable by an early childhood educator. This difference is expected and can be confusing for the child. So this is where open communication is key to come to an agreement so that all parties can respond consistently. When we talk about communicating with families, we want to know that our key role as educators is to work with families to support them in child rearing. This is done in both formal and informal methods during everyday practice. To be an effective communicator, we must flow both ways between parent and carer and the educator. Strong communication, particularly when dealing with behaviour, ensures consistent approaches. With your support, the family can develop routines and you can develop programs that are in tune with the child's individual strengths, preferences and needs. So the main takeaway point here is quality time together with parent and educator, and this way we can discuss potential barriers that may arise. So always take into consideration an understanding of the child in the context of their family. So looking at things like their culture, their community. You want to have knowledge of the child's developmental stage, understand their family dynamics, anything unusual that may be occurring within the family or influencing the child's behaviour. And information shared by families must be treated confidentially. So what can you do as an educator to guide behaviour? It's really important that we have conversations with the child's families about any strategies that we're going to implement. This will ensure that you work together and consistently. So we can establish a real and respectful relationship with each child, provide opportunities for children to attach and develop trust, respect and reflect the feelings of each child, and the culture of the family. Hold realistic expectations of young children, so don't make sure you're not expecting too much. Use language that's appropriate for the child to understand. Use encouragement with each child and make a point of affirming something they have done well. Avoid using sarcasm or put-downs or negative language. Make sure you have conversations with families around what strategies work for them and what may cause further challenges. Make sure they are aware that all families are unique and that they must utilise strategies that work for them. This can avoid trial and error for both families and educators. So really using any information they can give you. Some other simple steps that you or the parent or carer can follow. So the first point, tell the child your expectations and set clear boundaries. For example, instead of telling the child to stop being messy, communicate to the child, please don't throw your rubbish. We put rubbish in the bin. This way we can keep our room tidy. This informs the child what you expect and what is not acceptable, rather than just telling them what not to do. The second point, help children identify their emotions that may be causing their behaviour. For example, you might say, Jamie, I can see you kick the table because you're feeling very frustrated you cannot do the puzzle. Would you like to have a break and take some deep breaths? By doing this, children will begin to recognise and identify their own emotions and learn to self-regulate their behaviour. Encourage parents or carers to regulate their behaviour too, as part of role modelling. The third step, use simple words and calm tone when communicating. So when a child is highly emotional, they cannot always think logically. Your first priority is to calm the child. Give simple instruction and stay calm yourself as to not escalate the situation. Visuals are a great tool to use, and we'll see some on the next slide. And the fifth point, during play, you can teach children fundamental behavioural skills such as patience, turn-taking, positive social interactions, coping skills, and emotional regulation. You can role model or use peers to demonstrate appropriate behaviour. Play is also crucial for building attachment with a child. And the last step, allow time for new strategies to become effective. So repetition and consistency is key here. Allow a child several weeks before you assess whether a strategy is working for that child or not. So some other strategies we have here, ensure consistency between educators and parents. Be firm and consistent, so don't allow something one day and then not the next, because that will get really confusing for the child and they may start to test those boundaries. If unsure, pause to think about it or change your mind and explain why. So it is okay if you need to change your mind or if circumstances change and you need to go back on what you said, but make sure you communicate that to the child so they understand why that's happening. And lastly, follow through. So if you say the child is to do something, firmly and calmly persist. If we've asked for something to be done and we don't want to change our mind about it, then we need to make it happen. Sometimes we need to physically support the child to make sure that they cooperate. Acknowledge small steps and gradually reduce assistance given. On the next slide here, I've got some visual tools that we spoke about to guide behaviour. So lots of things where the child can actually see or predict what's coming next. So there's steps to wash your hands. You've got some behaviour cards, what it looks like to be upset. The now and next cards are really good so the child can predict what they're doing now and what's coming next so they can prepare themselves emotionally. And there's some different feeling charts as well. So now let's have a look at how we can promote positive behaviour through the routine and through play. So the first key is to always offer children choice based on their individual interests. So an example of this could be, Lucy, would you like to play with your dollhouse or do painting? By giving children choice, it really promotes their autonomy and allows them to feel like they're participating towards what they're doing. Secondly, we want to use this knowledge of interest to redirect if necessary. Sam, why don't we do some reading for a while? I know you're very good at reading. So maybe if you have a child that's becoming frustrated or becoming bored with a certain task, you can redirect them to something that you know they enjoy. And we always want to give notice before there's a change in routine or activity. So allow children time to prepare. James, 5 more minutes and we're going to sit outside to eat our sandwich for lunch. So start finishing what you're drawing. This just gives them time so it's not a sudden change, because we know that that can sometimes trigger upset behaviour. Some things we want to keep in mind when we want to immediately respond to inappropriate behaviour. We want to make sure that we respond to boredom, so making sure that we don't allow that time lapse for that inappropriate behaviour to occur. Try and understand triggers. So if a child is tired or hungry, really be flexible and adjust what you're doing with the child to meet their needs. Redirection, so de-escalating their emotions when necessary. Giving explanation, so explain to a child why something is happening. Encourage a child if you feel that they're giving up or if they're getting frustrated with a task, and help children to understand the consequences and impact of their behaviour. A great strategy for educators to follow is strength-based practice. So let's have a look at that. Another way to promote positive behaviour and respond to challenging behaviour is to reframe our practice. So not always thinking about what the child's doing, but what could we change as educators? So simply put, strength-based practice is exactly that, practice based on the child's strengths. It is based on the belief that we all have strengths and capabilities, that we can all change and grow given the right conditions and resources, and most particularly when we harness our strengths and capacities. So think about a child with a challenging behaviour and respond to the following questions. So this is a good thing for you to reflect on as an educator. What is a key strength that the child possesses? How are these strengths demonstrated? What can stop you or others from seeing and appreciating these strengths? So maybe sometimes the inappropriate behaviour overwhelms their strengths and we forget to see those strengths. What can you do to recognise, acknowledge and utilise the child's strengths more regularly? So say, for example, you've got a child that shows inappropriate behaviour in the lead up to lunchtime because they get a bit ratty when they're hungry. But you know that that child's got great self-help skills and they love to help. Maybe you can set them the tasks of preparing for lunch, setting the table or helping prepare the food to mitigate those inappropriate behaviours and redirect them into something positive. As an educator, we can also role model behaviour guidance to the parents or carers. In-home care educators can find it challenging to guide a child's behaviour when the parent or carer is present. The key to overcoming this challenge is open communication, boundaries and consistency. If families need support on how to respond to challenging behaviour, educators can provide professional support. Make sure you do this without judgment. Make sure you provide empathy. So think about how the parent might be feeling and always invite collaboration. So your key is to work together here. Aim to be supportive, respectful and knowledgeable when approaching families about behaviour guidance. Remember you are a professional employee and you should remember it's a common goal between you and the parent. Even if you don't have a solution straight away, always present a positive attitude and work towards problem solving. Some challenges for educators. In Australia, we celebrate a great diversity of culture within our communities. However, this does mean that we can see many differences in child rearing practices and developmental expectations and acceptance of different behaviour. So consider children's behaviour in the context of their culture, their community and their family, and in relation to their individual stage of physical and intellectual development. This will assist us in working with the child. So behavior guidance encourages children to reflect on their actions and the impact those actions have on themselves, others, and the environment around them. We are not wanting to punish the child. We do not expect them to behave perfectly all the time. As educators, we must accept and respect that children are learning appropriate ways to behave. Behaviour guidance based on positive and respectful relationships between educator and child is most likely to influence behaviour in constructive ways. We want to always maintain a positive relationship with the child so they trust us and take on our learning. When negative relationships develop between adults and children, this is where we can see children demonstrate defiance. So remember, develop positive relationships with children, and this will ensure that your behaviour strategies can work. So to recap, behaviour guidance should demonstrate respect for children, be based on knowledge of the child's development and learning, be based on an understanding and knowledge of each child, be proactive and positive, recognize the child's strengths, not use any form of corporal punishment or any discipline that is unreasonable, and not involve making judgment about the child or their family. So part of our role as educators may include engaging families in conversations about their child's behaviour, and this can be difficult. If you have already developed a trusting and positive relationship with the family, it will be easier to approach the parents or carer, and they will respect you are coming from a place of help rather than a place of judgment. Listen to the family, and this is key. They are the experts in regards to their child, and the more that you listen and value their opinion, the more you can use this when developing appropriate behaviour strategies. Try to understand their perspective and their emotional investment. Always share the positive about the child so that when you do need to give honest information about inappropriate behaviour, this is balanced with positive feedback. Remember, any emotional blame from the conversation, even if you're feeling frustrated, you are in partnership with the family and you need to maintain this in order to have the best outcome for the child. Be honest and open, providing accurate information on what is observed. For example, Johnny was playing well at the park. However, after a few minutes, he began to push the children next to him. Gather as much objective data on the behaviour through observation and conversation so you have examples to refer to when approaching the family, because that's quite common for the parent or family to ask for specific occasions or examples of where you saw that behaviour. And thirdly, make sure you have solutions ready. This allows you to showcase your professional knowledge and experience, and so you're not just approaching the family with problems. When professionals and parents share knowledge, it has the best outcome for the children's well-being and development. So when you do provide suggestions, make sure you ask for parent input and allow them to make the decisions. So ask them, how do you think we can support Mary to play well with others? Or can I suggest a behaviour chart or some social catch-ups with families? Which one would you prefer? So be prepared with approaching families, give them options. They can become upset or stressed if they so think carefully how to best deliver your approach. Choose an appropriate time to do so as well. So try and avoid these difficult conversations when parents and carers are busy or distracted or in a rush. So let's have a look in a bit more detail about that problem-solving approach. So if a difficult behaviour persists, then we need to look for the child's underlying motivation, the feelings behind the behaviour. So they might be wanting to escape or avoid an unpleasant situation. They might need to gain attention, or whether that's positive or negative attention. The child sometimes doesn't differentiate. They just want adult attention. Or they might be frustrated and not expressing their needs properly or not having their needs fully met. So any problems should be discussed with the child's parents or carers to help determine possible cause. So the steps to follow a problem-solving approach, we want to identify the problem. We will then brainstorm as many solutions as possible, decide on which solutions to try and then implement them, and then evaluate the solution and its effectiveness. And if for whatever reason those initial solutions that we implemented aren't effective, we can go back and try some other ones. I've got some more reflective questions here that we can ask ourselves as educators when faced with challenging behaviour. As an educator, if you observe the family's, parents or carers' behaviour or strategies are causing harm or making things worse for the child, please contact your service provider immediately to discuss. So some reflective questions we can ask is, how do you expect children to behave? And are these expectations fair and appropriate? Are you aware of what you feel may influence the way you act? So having a look at our own biases or our own prejudice towards the child. Are you labeling the child and expecting poor behavior? So we need to make sure that we are always expecting the best and we allow children to show that positive behavior. Do you remain calm or are you losing it, raising your voice, blaming or labeling the child? If we're demonstrating those behaviors, then the children are going to take that as role modeling. So we can't expect them to act appropriately if we're not role modeling appropriate behavior to them. And the last question, do you consider the child's feelings behind the behavior? So we've spoken about that quite a lot, looking at what's causing that behavior. Remember that the way we look, the way we respond, the way we talk, and the way we listen to children, all of these things affect our relationship with them. Children will model their own behavior on the behavior of people who care for them. So we need to model appropriate behavior and maintain our own self-control. Demonstrate the kind of behavior we wish the child to develop. So to recap on responding to a child's behavior, making sure we always respond calmly, positive reinforcement, so focus on considerate behaviors, catch them when they're behaving appropriately and acknowledge it, help children to talk about feelings, and we need to teach them about feelings. Listen and help distinguish feelings from behavior. So unacceptable behavior is rarely about seeking attention, but children can learn to get attention through behaviors, particularly if that is the only time they really get attention. So if you're only giving a child attention when they do inappropriate behavior, they're going to make that connection and they'll eventually start doing inappropriate things just to get your attention. So sometimes it's better to ignore inappropriate attention-seeking behavior if it's not hurting or bothering anyone. If you need to react, do it calmly. Instead, ensure the environment is appropriate for the child's needs and focus on considerate behaviours. So making sure you acknowledge when they do something good. And talk about feelings, so give them attention if they need it. Remember, it is the behaviour, not the child, that is inappropriate, and the child should know this. So never make it personal. So if despite all of this advice and guidance, what if it's still not working? So there is additional help. Whilst we as educators have a great amount of knowledge of child development and how to promote well-being, we need to remember that we're not professional counsellors or psychologists. So there are times when children may be experiencing mental health difficulties and they are in need of early intervention. So you could refer to an organisation such as Beyond Blue. They were appointed to lead BU by the Australian Government since 2017, and they build on the success and learning from the existing programs focusing on children's mental health and wellbeing in early childcare services and also for all early childcare educators to implement. So they use a prevention and early intervention framework, and they provide early childhood educators and families with resources and support. So that's definitely somewhere you could go for some further information. We've also got all the links and some additional references that we've referred to today. So Early Childhood Australia have some great fact sheets and information. There's the BU website. Raising Children Network, that's a really great page for families and carers if you need to refer them on. And they cover a huge variety of topics, really focusing on child development. And there's a lot of behaviour in there as well. Kids Matter, the Understanding Trauma fact sheet, and Emerging Minds, some more information on trauma behaviour management there. We've also got the guide to the NQF information, learning links, and collaborating with parents in using effective strategies to reduce children's behaviour. So there's some really good further information for you. So that does bring us to the end of the session today. I hope you have enjoyed it and you have benefited a lot, and we hope to see you for another webinar soon. Thank you.